This podcast is supported by MIDI Health. Are you in midlife, feeling dismissed, unheard, or just plain tired of the old healthcare system? You're not alone. In fact, even today, 75% of women seeking care for menopause and perimenopause issues are left entirely untreated. But it's time for a change. It's time for MIDI. MIDI's not just a healthcare provider. It's a women's telehealth clinic founded and supported by world-class leaders in women's health. Their clinicians provide one-on-one, face-to-face consultations where they truly listen to your unique needs. They offer a full range of holistic, data-driven solutions that isn't one-size-fits-all care. This is care uniquely tailored for you. At MIDI, you will find that their mission is clear: to help all women thrive in midlife, giving them access to the healthcare they deserve. Because they believe midlife isn't the middle at all. It is the beginning of your second act. Ready to feel your best and write your second act script? Visit joinmidi.com today to book your personalized, insurance-covered virtual visit. That's joinmidi.com. MIDI, the care women deserve.
Yay Media Group. Lymphatic drainage is everywhere right now. You might see it called lymphatic massage. You'll see it talked about post-surgery, but also on spa menus that are promising us detox and bloating, even weight loss, flatter stomachs. But what is it actually doing in the body? What is lymphatic drainage? Where does the science stop? And where does the hype start? So today, we're breaking it all down with a certified lymphatic specialist. What helps and who can truly benefit? A quick note before we dive into today's podcast. If you like what you hear, I would love for you to subscribe to Fueled Wellness and Nutrition, wherever you download your podcast. It would also be incredible if you take a minute to rate and review this podcast. Those things do matter, and they really help us. I'm Molly Kimball. Welcome to Fueled, a wellness and nutrition podcast. I'm a registered dietitian and nutrition journalist with a passion to help people live their strongest, healthiest life possible. In my weekly TV segments and columns, there's a limited amount of time and space to cover everything, but there's so much more to share. This podcast is my opportunity to dive deeper into the topics you want to know about. Welcome to Fueled Wellness and Nutrition. I'm registered dietitian Molly Kimball. We are talking about lymphatic drainage today. So you may hear it referred to as lymphatic massage, but lymphatic drainage has become one of those terms that it's popping up everywhere. Social media, wellness clinics, it's in recovery protocols post-surgery. But most of us, myself included, don't fully understand what it is or whether we need it. And if we do, when do we need it? So to help get the full details, to inform myself also, and I always love when I can learn something from it, I'm hoping that you're learning from it as well. So we're getting the full details on everything lymphatic drainage. I'm joined today by Shannon Oge. She's a physical therapist with Ochsner Health. She's a LANA-certified lymphedema specialist. This means she's somebody who works clinically with the lymphatic system every day. She's not doing it from a spa lens, but from a medical evidence-based perspective. She and I will talk about how the lymphatic system works, what lymphatic drainage actually does in our bodies, who it's designed for, and where our expectations can get ahead of reality. And for those of us who just want to feel a little bit less puffy or less inflamed or better overall, we'll also talk about what's going to actually move the needle. So welcome, Shannon.
Thank you so much for having me.
Oh my gosh. So yeah, this is a question that I had actually Kerrigan, who I do our WGNO segments with, was like, let's talk lymphatic drainage. I'm like, let's, but I also need to learn more. So Shannon, tell us, what is the LANA certification? What does this mean? And tell us about a lymphedema specialist and your background, your expertise, and what brought you here.
Absolutely. So I am a physical therapist first and foremost. And then after graduating from physical therapy school and getting my board certification, I got an additional certification to become a certified lymphedema therapist. And then after that, after a couple of years, I decided to join the Lymphology Association of North America, or LANA. And so that is just an additional certification that shows I've just put in a little bit more study about the lymphatic system and lymphedema treatment to just try to better help my patients.
So as a physical therapist, what got you into that space? What kind of prompted you to go more into this area?
So I got to do certain clinical rotations as a physical therapy student, just like anybody else would. And unfortunately, none of those did involve lymphedema therapy. But when I was doing my last rotation, I did have a patient who had lymphedema, and kind of just doing my own personal research on how to treat this person that also had lymphedema, I was very intrigued by the conditions and everything that entails lymphedema therapy. I graduated physical therapy school during the middle of COVID. And so normally after graduation, employment for a therapist is 100%, but there was a hiring freeze. And so I said, well, I might as well make myself a little bit more marketable while I'm waiting. And so I said, why not get my lymphedema certification? And so I was lucky enough to have interviewed with Ochsner before. And then once I came back and said, hey, by the way, now I'm lymphedema certified, they were like, oh, we have a spot for you
Right.
because
Oh,
there's
that's
not too many
awesome.
of us.
Right, right. So the plan worked. And so when
Yeah.
we talk about lymphedema or the lymphatic system, break it down in just kind of simple terms for someone who I think most of us are familiar generally with the lymphatic system. But when we're talking about lymphedema and the lymphatic system, just kind of give us a high level rundown to set the stage as we're moving forward, too.
Absolutely. So the lymphatic system is a series of vessels and organs that primarily are responsible for two major functions in the body. One is fluid balance, and then the other one is it plays a very important immune function in the body, so helping to fight off infections. So initially, what the lymphatic system does is it takes fluid that is all throughout our body and it transports it through lymph vessels. These lymph vessels connect to what are called lymph nodes, which help filter out anything that could potentially cause infection in our body before this whole lymphatic system connects this fluid to the rest of our circulatory system, and the cycle continues on and on.
So, when it comes to the regulation of fluid balance in the body, but then also things like waste products or metabolic byproducts, how does the lymph system, how's it involved there?
So, there is a part of your circulatory system called your capillaries where your arteries drop off blood and other products, and your veins take deoxygenated blood and other products and bring it back to the heart so that this system can continue. The lymphatic system initially lives in this connection area, and it takes some of those waste products and fluid that your veins can't take, and it separately transports those waste products up and back to those drop off points. And along this process, they pass through the lymph nodes, and those lymph nodes act as kind of almost like filters that help provide that immune support. So if you've ever had a cold or something where your lymph vessels do get swollen, or you've been to a doctor and your doctor's checking out your lymph nodes, that's because your lymph nodes play such an important immune response in your body. And sometimes they do become swollen when they are actively fighting infections.
And so, what is y'all refer to it as MLD, manual lymphatic drainage, and what is manual lymphatic drainage? Like from the patient or client's perspective, what do they experience? Walk us through what that looks like.
So, manual lymphatic drainage is a manual technique designed to assist this transport process that your body is naturally doing. And so, we're assisting that fluid that initially accumulates a lot of times right underneath the skin and a certain part of the body. And we are helping that fluid go from the initial transport systems to the deeper ones, and specifically pushing that fluid towards areas of lymph nodes in your body. For example, you have some in your underarms, you have some in your hips. And so these bundle of lymph nodes are kind of along that transport pathway that eventually leads to the rest of the cardiovascular system.
And you mentioned, as we were talking before we started this podcast, some of the places that someone may experience lymphedema would be in their arms. Sometimes their whole arm might feel puffy or fluid retention, especially if they had gone through breast cancer treatment, for example, or it could be in their leg if they had different types of other types of cancers or other conditions. And so what does it feel like? Say what someone has lymphedema in their arm. Is it kind of long sweeping strokes? What does it look like for that lymphatic drainage that shift that fluid? It sounds like it's kind of from that surface level where it's not supposed to be, that it's just shifting it back away from that.
Absolutely.
Okay.
Absolutely. So sometimes people think of massage as like a deep tissue massage where it needs to be very firm pressure. That Initial lymph fluid that accumulates in people that have lymphedema is very superficial. It's not underneath our bones or our muscles. And so it is a very light type of massage. And so it's going to be a very light series of sweeps up towards those area of lymph nodes. For example, if somebody has lymphedema in their arm, we're going to direct that fluid out of the arm towards the underarm area where we have a bunch of lymph nodes accumulated.
And you say too, when you're working with patients who've gone through something that they do truly have lymphedema and they are meeting with you for what might be a series of lymphatic drainage sessions, you'll also teach them techniques that they can do at home so they can maintain it in between.
Absolutely. So we kind of split our treatment into two parts. We do what we would call a reduction phase, where we're trying to actively reduce the swelling as much as possible. And then, of course, there's a maintenance phase. And so for people that have lymphedema, the part of the maintenance phase is going to be the daily massage of their own limbs to help keep this fluid as much to a minimum as possible in that particular area.
It's kinda like physical therapy is, like, when you go to physical therapy, you're meeting with your physical therapist, and they're showing you if it's for a hip injury, for example, and you've got your exercises you're doing with the physical therapist there, and then there's some that you're doing at home, and then gradually more and more of that becomes our homework to maintain healthy back or hips or whatever it is at home. And
Mhm.
so something like this, the lymphatic drainage techniques, it's not very different from that. You're doing it there, you're getting the primary benefits probably started there and then but it's not something that's a one and done with y'all. It's something that they can continue at home and that maintenance is going to be important there. It sounds like.
Absolutely. A core kind of part of any type of physical therapy is helping people regain independence. And when somebody is doing lymphedema therapy, that's definitely no different. We want to help people reduce their initial symptoms as much as possible. But the nature of lymphedema is going to be a chronic one. And so, most importantly, out of anything, I want to get people set up and as independent as possible with managing this so that it can be as least intrusive in their life as possible.
I would imagine a lot of people when they're I'm thinking of myself, but when they get massage and you mentioned it's not a deep tissue, but sometimes if you think, "Oh, for this to really be effective, I need to feel pressure. It needs to be almost borderline really deep in there and almost painful." So I would imagine someone who has that mindset when they're coming for the first session of lymphatic drainage, they may think, "That's it," because it seems like it's probably a much lighter, gentle approach, but that's what's really needed to be effective.
Absolutely. I really love part of my job is generally this kind of therapy is very relaxing. It's not supposed to be painful. You know, I've had people on my treatment table and they kind of tense up because they're waiting for a deep tissue
Yeah.
massage, which
Right,
sometimes can border on uncomfortable, especially like a sports
right.
massage. You want to get that hurts so good effect. And
Right.
I get to be the person that tells them, no, it's going to be relaxing. It's going to be very soft. You're not going to hurt, which is a really fun part of my job.
Talk to me about the typical types of patients that you're seeing, and then I want us to get into some of the benefits that people might expect when they don't actually truly have lymphedema, but why people are looking at lymphatic drainage or lymphatic massage, um, and they don't have true lymphedema. But starting with your patients, and we mentioned people who are post-surgery, they've gone through different types of cancer treatment. Who else is gonna come in that can benefit from lymphatic drainage?
Absolutely. Besides people that have a true blue lymphedema, maybe they were born with lymphedema or maybe they developed it later on through injuries or illnesses, we also see people that sometimes have a more temporary post surgical swelling. This can be beneficial to help them get to that healing process a little easier. Swelling is a first step of the inflammatory process. And so when anyone has a surgery, you're going to have swelling. But what we do may be helping any of that residual swelling that could be interfering with the other natural steps of healing. But besides that, I also help people with what's called chronic venous insufficiency. Well, chronic venous insufficiency is by definition an issue more with the veins and so blood accumulation in parts of the body. We know that physiologically, the venous insufficiency and lymphedema are so similar that people with venous insufficiency also get a benefit from that massage. I also I also help people that have what's called lipedema. Lipedema is not an accumulation of fluid, but it's an irregular distribution of fat cells somewhere in the body. And what happens is sometimes the lymph drainage that naturally occurs in people can be impeded a little bit by this irregular distribution of fat cells. And so, for temporary measures and to help with getting them ready for a home management program, people with lipedema can also benefit from massage.
There's a lot of marketing around lymphatic massage, and as you and I were talking about it again before this interview, what you do is called manual lymphatic drainage or lymphatic drainage techniques. And you pointed out that a lot of times what might be at a spa is going to be referred to as like lymphatic massage. So kind of avoiding the more clinical name for it. And I just pulled up, a couple of just even local spas. Some of the things on there, it's marketing lymphatic massage for post-surgical swelling. Which is sort of along the lines that we talked about. But, I think it's important to note if someone's looking at this and you're truly looking for it because you have a clinical reason, you do have post-surgical swelling, have true lymphedema, like what Shannon was talking about, it is important to go to someone who is specifically certified in this. And so looking at someone is the gold standard, the LANA certification that we talked about.
So the gold standard, I think, would definitely start by being certified lymphedema therapist. And so that can be actually a physical therapist or an occupational therapist. So we are defined as people that helps individuals with lymphedema. Manual lymphatic drainage is just a small part of what we do. People with lymphedema also need compression garments. They sometimes benefit from compression bandaging that we do to help reduce the size of the limb. And then we also, of course, as any type of physical therapist, we're going to help with exercise. And so that kind of is just an overall idea of what we do for someone with lymphedema. If somebody is going to a spa and they're recommending a lymphatic massage, it may not be your true blue manual lymphatic drainage. Now, it's important to note that there are massage therapists that become lymphedema certified. While they won't do the assessment and the treatment that maybe we do in the clinic, they can absolutely be certified in manual lymphatic drainage. And I absolutely love referring my patients to a certified massage therapist once we're done if they want someone else to be performing the massage on them. But I think there is an important difference between a true manual lymphatic drainage massage and more of a lymphatic massage that maybe someone might get at a spa.
Right.
While it might not be inherently harmful, I think the expectations are where things can become so crucial
Right.
because someone that has a fully functioning lymphatic system may get very temporary benefits of these types of massages, but as far as making structural changes or some of the more outlandish claims, I
Right.
think that's where it's important to make a
Right.
difference.
As we were talking, I pulled up a website and I just typed in lymphatic massage detox. And one of the websites that pulled up, the very second one that it was talking about for lymphatic massage promised a flatter stomach. So it's like,
Yeah.
I mean, we all know that the quick fix it's been a tug on our will as a society for as long as we know. I think when we look at, well, what's a quick fix that I can have a flatter stomach, that I can help my body remove the toxins? If I'm drinking too much alcohol, then I'll just get my lymphatic massage and work those toxins out. We're always, as a culture, it can be really easy to be tempted and swayed by that quick fix. And there's so many things out there that promise that quick fix. And I think that lymphatic massage is one of those that's getting a little bit more visibility now. And so I think, just like Shannon was saying, is there harm in it? No. And it can be relaxing. It can feel good. And there might be some benefit, that, as you said, it might be temporary, but there can still be some benefit. But I think when we look at just like anything else related to nutrition, related to supplements, related to even skincare, if we're not doing the right things as our foundation, then adding something like a lymphatic massage here and there is not really going to move the needle. It may make us feel good in the short term, but it's certainly no replacement for those healthy, sustainable behaviors. So, on that note, talk with us about when we're moving. I think about when people, just myself too, sometimes you wake up and whatever either dinner was or how you slept or hydration status, you may have puffiness around your eyes or your rings might be feeling tight. And as soon as I go for that morning walk, doesn't even have to be long. It could be like a little 20-minute walk. My ring is less tight. That puffiness seems to go away. So talk with us about the regular movement that we are including, just walking our dog, playing with kids, things like that. Also, purposeful exercise, cardio versus strength training. What is the impact of that movement and these different types of movements on the lymph system?
Yeah, I think that's a really incredible part of the lymphatic system. One of the reasons that I think the lymphatic system is kind of a bit underappreciated and underrepresented is because it works so seamlessly for healthy individuals. And one of the main ways that the lymphatic system is moving fluid is through contracting and relaxation of our muscles. And so, walking, like you said, exercise, but also just more subtle movements like deep breathing, where we're using our diaphragm to contract and relax, as well as fun things just like laughing, those all stimulate our lymphatic system. And so, in a healthy individual, this lymphatic system is relying on those everyday movements to move this fluid effectively.
I think it's so interesting that even deep breathing, I
Mhm.
didn't realize that. That's really cool. So we love doing, deep breathing. We've talked on this podcast before. I love, like, I call it the 4-7-8 breathing, where you breathe in for 4,
Mhm.
hold it for that count of 7, breathe it out for a count of 8. Part of it, I think it helps people kind of in that moment, dial things back. You're also thinking of those numbers, meaning you're also going to kind of shift all the other clutter out of our minds for that little bit that you're counting, which helps some. But that is impacting our lymphatic system and our fluid shift.
Absolutely. So, diaphragmatic breathing has so many benefits, like you said. There's the relaxation. It's telling our central nervous system that we can stop and relax and that we're in a safe state of being. And then, when it comes to the lymphatic system, the pressure that is exerted in our abdomen by our diaphragm, and so specifically our diaphragmatic breathing, not as much our chest breathing, but that true belly breathing that we're able to do, that is going to put pressure and contract and relax to help pump those lymph vessels that are
That's
more
cool.
internal.
And laughter. That's really
Yes,
cool. Yeah, I
absolutely.
love that.
Yeah, just talking and laughter. I think that, like I said, the lymphatic system works so seamlessly on most individuals every single day. And that's kind of why we sometimes think about it more as in the background because it's doing such a great job with everyday activities.
And so for that reason also, most people probably don't, quote, "need" lymphatic massage just to do what our bodies are already doing. But for the person who truly has lymphedema, but a lot of times that's gonna be, like you said, somebody can be born with it, or it might be related to a surgery or an injury. There's specific conditions that someone has this and can truly benefit from it. But if you're doing all these other things and you don't have those conditions, it's probably not it's probably not something that needs to be at the top of our list because it's happening anyway. But we can do things, if someone has a very sedentary job, they're at a computer all the time, they're in the car all the time, that wouldn't be good. So making sure you're avoiding that just kind of prolonged being sedentary, you're getting moving, you're having those movement breaks. Is there a difference between strength training and cardiovascular training as far as the impact on the lymph system?
So both of them are wonderful. So when you have a cardiovascular exercise, especially let's say in the legs, maybe you're on an elliptical or you're running, we know that is rhythmically contracting and relaxing your leg muscles. And so that is acting as a pump, especially on the leg lymphatic vessels. When someone does strength training, you're kind of strengthening and increasing the effectiveness of those pump muscles that pump on those lymph vessels. And so both of them are going to be uniquely important in what we do. I always tell my patients with lymphedema, very, very outdated thinking with lymphedema was don't move that limb that has lymphedema, just rest,
Yeah.
and like so many other things in the medical field, we keep seeing the benefits of early exercise and movement, and lymphedema is no exception. We now know that, especially with compression garments, people with lymphedema are going to absolutely need exercise, both cardio and strength training.
And so whatever it is that works within somebody's abilities and or working around their limitations, it sounds like one of the most powerful things we can do just in general for our mental well-being, for our whole body wellness and including lymphedema is to move our body regularly in whatever way that looks like for the person. When you see things like the claims for lymphatic massage, for detox, for weight loss, for fat loss, for that flatter stomach, like we just pulled up, for the person who says, "Ooh, I'm going to go get lymphatic massage because, it's, I'm going to have one of these types of benefits. What do we say? Like, what is your response or kind of like what's in your head? And you can say it unfiltered here.
As much as I would love for it to be maybe as quick of a fix like that, I have a lot of patients that come in that I see that have lymphedema. Maybe I have someone that has leg swelling and they say, well, if you can get my leg down, haha, do you think you could get my stomach down too?
Right.
And I always joke with them that I'm like, if I had those powers, I'd own my own private plane. But unfortunately, that is not something I'm able to do. We know that kind of like if somebody has some sort of product that is claiming a detox on the body, and a physician says, well, your liver is the detox organ in your body. So maybe it's kind of similar to that respect. Your lymphatic system in somebody that doesn't have lymphedema or doesn't have any issues with the lymphatic system, you may see temporary benefits. We're kind of helping along that process, right? So you might see some temporary decreased puffiness in certain areas, but we're helping a perfectly functioning system. And so we're not going to see any major structural changes in our body. And then also kind of maybe adjusting the expectations of what we're going to see. Maybe someone has a big event coming up and they're like, you know what, I want to be as debloated as possible. And so maybe a lymphatic massage will give them some sort of temporary benefit, but it's not going to change things permanently, right? And so I think those kind of expectations are important. And to give an idea to a patient that has a perfectly functioning lymphatic system, you never want someone who does not have a problem with their body to think that without a certain service, their lymphatic system cannot function correctly. And I think that's a very important part of all of this as well.
I think that's a huge point to make. And also, there's only a limited amount of time, money, resources. And so, if
Yeah.
someone has an otherwise perfectly functioning lymphatic system, where is their time and their focus best spent? Is it best spent on getting that extra little edge on that, what might be a temporary benefit that they may see, or putting that time, resources, money into something else that might be even more impactful holistically? Is there anybody that you would say we don't want to get that should avoid lymphatic drainage? Is there anybody that this would be just kind of a contraindication for?
Definitely. People that have active infections, for sure, we need to try to avoid or at least get your doctor's approval for this kind of thing. People that have certain cardiovascular conditions, we need to think about, okay, if we are actually helping to push fluid to the heart, is our heart able to handle that right now? And so that's something we definitely need to think about. Kidney failure is a big one as well. So any of those major chronic conditions that are affecting our organ systems, we need to get our doctor's approval before we do any of this. And that's certainly something we do in the clinic as well. We're always going to check and make sure that our physician in charge is going to say that everything else with the body is able to handle this lymphatic procedures.
If someone is seeking this out, who would you say? I guess what are the things that for someone to kind of in their own checklist in their mind say, when would it be worth seeking this out? What would be the conditions? Or how it like what symptoms would be on someone that they would say, I'm experiencing this or I'm seeing this, especially if it's a change from the norm that might signal to talk to their provider about this.
Absolutely. So, lymphedema in the very beginning stages are going to be rather subtle. And we're also going to be looking out for certain injuries or illnesses that may predicate these conditions. So, if somebody has perhaps a major injury or illness, and then afterwards they're experiencing limb heaviness, maybe rings don't fit on the fingers, maybe sleeves don't fit with the arms as well as they once could anymore, maybe shoes aren't fitting, and then progressive worsening of this swelling. So, it usually starts in the beginning stages of lymphedema as swelling that maybe comes and goes. But then
Mhm.
eventually, as this lymphedema progresses into later stages, the swelling may just kind of stay. And so these are signs that someone should reach out to their care team and discuss options because we know that while we can treat anybody that has lymphedema, early intervention is going to be most successful. So we want to get people in before it's really affecting their function and their mobility. We want to get them way before then because we know the treatments that we offer work most effectively in early intervention.
And tell us again what this certification is that the credentialing to look for as you're working with someone who's going to work with you, this person on lymphatic drainage?
Absolutely. So, if someone has lymphedema and they're looking for treatment, we're going to look out for a certified lymphedema therapist. That can be a physical therapist or an occupational therapist.
Okay.
If somebody has lymphedema and they are looking for manual lymphatic drainage only, they can look out for a massage
Okay.
therapist. You can call a massage therapist and say, "Hey, are you certified in lymphatic massage?" And they can tell you. When I did my own training to be a certified lymphedema therapist, we had therapists, but we also had massage therapists. And they came in knowing, okay, I'm not going to do the bandaging and stuff, but I'm going to become really solid at this massage and
Right.
offer that to lymphedema patients.
And if someone is there anything that you can tell us that would be a visual for our listeners who are hearing us only but not seeing us to that they could start to do that would just be a little something that would maybe benefit what they may feel of circulation or fluid balance, just whole body, that you would say is just sort of a basic broad sweep? Or is that me asking one of those questions that's also impossible to answer?
As far as when it comes to the actual massage itself, you can think of a light sweep on a part of the body, for example, the arm. You're still going to want to get that skin stretch. So you're not just skimming over the
Mhm.
skin. You want a little bit of a stretch and release, but it's pretty light.
And
And you
so
want to start
do you do like a
exactly kind of
okay,
like
we're
a
on
sweep
video,
and
y'all, for our
release.
listeners as we're looking, but I know our listeners aren't all gonna have this. So it's a little bit of a press and a sweep, and you would do it
Yes, a
towards your
sweep and
nodes.
release, sweep and release. We need that release to allow those lymph vessels to refill with that fluid. And we're starting usually a little bit more distally, so away from those lymph vessels and going towards.
So on
Never
someone's
pushing.
go ahead, sorry.
So, if, for example, somebody is dealing with arm swelling, we're never going to be pushing it down towards the hand. We're always pushing up towards those bundle of lymph vessels in the underarm.
So
If
we would
someone is,
have go ahead, I'm just excited.
no,
Keep
no, go
going.
ahead. No, no, you're
So
fine. Go ahead.
so if you have your arm, you would start more at the fingers and kinda do the sweep and then work your way up the arm as this.
That's kind of hard because our direction is towards there. But like if I have somebody that comes in that has lymphedema in the arm, I'm actually starting up closer to
Okay.
where we want everything to go. Because think about it like a traffic jam. If you have a traffic
Yes.
jam, you need to get the cars in front of you
Mhm.
to leave first. You can't just push from the back,
Right.
right? So,
Right.
this, for example, I'm going to clear the upper arm in each spot before I go to the lower arm.
Yeah.
And then I'm going to go back up the way I came at the end.
Do you go in all like, again, on I'm doing it on my arm as Shannon and I are talking. Do you sort of hit all sides of your arm, or do you do
Exactly.
so you would go around
Absolutely.
all and then just
Exactly, just like you're doing. Yep, so
yeah.
I would maybe do 5 sweeps on the absolute outside of the upper arm, maybe like 10 sweeps on the outside of the upper arm. Then I would do 10 sweeps on the inside and 10 sweeps on the back. And then I would clear myself to go to the elbow, maybe the inside of the elbow 10 times, outside of the elbow 10 times before going down to the forearm and
Mhm.
doing 10 sweeps on this part of the forearm and then the inside and just making sure we're kind of clearing each section of the arm before we go down farther. And then I retrace my steps. So then when I get to the hand, it's like, well, what did I do right before? I go back to the forearm and I'm going back up the way I came.
And so you kind of work your way backwards. No, I think that that's a really helpful visual. It's also it can be one of those things that if you're just sitting at your desk or you're on a call, why not do a little of that? It's not
Yes,
harmful, and it's
absolutely.
again, if we always talk about small movement breaks or things like that, but if you don't have the ability or if you're on an airplane or something like that,
Mhm.
do you mind humoring us? And it seems like it would kind of be the same on your legs. You would start on your upper thigh and kind of do the same?
So, a true lymphatic, manual lymphatic drainage is going to always start at the collarbone area because this is where all of those lymph vessels are connecting into two veins before become part of the circulatory system. And so, the best way to think about it is you bring your shoulders forward and you cross your arms and you find that little soft spot right above your collarbones. And you take your fingertips and you're going to just do like 10 circles right there. This is what we call the terminus. That's where those lymph vessels are connecting and dropping that lymph fluid to. So if I have some leg swelling and I want to try to address it a little bit, I'm going to start here. Then maybe I'm going to go to the abdomen. So I'm kind of going along that pathway, but starting at where we end instead of starting where we begin. And maybe I'm going to do my 10 diaphragmatic breaths. Then I'm going to go to my little hip crease. So kind of that crease that your hips make when you lean forward. We have a bunch of lymph vessels there. And so we're going to do little circles there. Then we're going to go to the thighs. And so I'm going to start on the thigh and I'm going to take both my hands and I'm going to sweep my thigh towards the heart. And I'm going to address each part of the leg in the thigh. Then I'm going to go to the knee. Maybe I'll do 10 sweeps on the front of the knee, 10 sweeps on the back of the knee, always towards the heart though.
Yes.
We're never pushing things down towards the toes. Then we go to the lower leg and we do 10 sweeps on each part of the lower leg. Then we do the ankle. So for the ankles are kind of small. So we can usually just kind of take both of our hands and go like this. And then we do the foot, most of the time just the top of that foot.
Okay.
And then we just retrace our steps. So we go back up the way we came.
God help anybody who's sitting next to anybody on an airplane who's listening to this, who's like, you look over, someone starts doing this, and you're going to be like, oh, here it comes. Watch out.
Conversation starter, maybe.
Depending on the person next to you, you may be like, let me show you. How.
Yes.
So
the
that's
whole
really
plane involved.
That's really, I mean, I think an airplane is actually a perfect place though to think about when you don't have the ability really, you can get up and move around a little bit, but it's a hard thing and you can be there for an extended period of time. And so some of that you may not, depending again on your seatmate, you may not be comfortable doing like right there. But as if you're getting up and you're doing some of it in your seat, you can do where you sit kind of at that space by your collarbone, like that kind of soft tissue there and start there and do your diaphragmatic breathing. You may get up, do your walk, go to the bathroom and do some of your other things, depending again, if you're with someone you know, then you can do it all there. If not, that's still something that you can do. And it seems like for the normal, average, healthy person, even if they don't know exactly what they're doing and they maybe saw what we did right here on the video part on social media, but otherwise they're listening to us and just kind of imagining what we're talking about. For the average, healthy person, something's better than nothing, especially if we're in a situation like an airplane. Yeah.
Absolutely. So the nice thing we know about manual lymphatic drainage is that even if we can't reach all the way down our leg, because maybe older individuals or individuals with mobility issues, maybe they're not going to be able to reach the bottom of their feet. But we know that when we help guide that lymphatic system and promote it to work a little bit better in areas closer to our heart, even if we can't get all the way down to the leg, if we do the things we talked about at the neck, at the stomach, at the hip, it acts as a negative pressure. It pulls that fluid out of those areas. So like you said, something's better than nothing. Even if we can't do the full gambit, we know that doing some is absolutely helpful. If, for example, a healthy individual is maybe going on a flight and they're like, I want to try to avoid swelling. Well, we know prevention is key, right? So maybe some compression socks, always recommended. Like you said, even if someone can't get up and walk the full length of the plane, because I know I have trouble getting the courage to do that, maybe just standing up and doing some ankle pumps. So just pumping the ankles back and forth in sitting or standing. That's going to contract and relax those leg muscles to help guide some of that lymph fluid out. And then, like you said, when you're able to, some massage is also helpful.
Yeah, I love all of this. And so our takeaway is for the average healthy person, our lymph system is working pretty well. It's sort of up to us of how much time do we want to spend of the time or the resources, the money, the energy to give that extra little edge to something that's already probably doing a pretty good job already. The things that we're seeing marketed of massage for detox or flatter stomachs or weight loss, probably not going to have a significant effect there. And I think we could probably take the probably out of that. And again, there's so many other things that we can do and prioritize nutritionally, movement wise, et cetera, that's going to be more helpful there. And then for the person who does have lymphedema, I think about my mom, the last few years of her life, she was wheelchair bound and she had no use of she couldn't move her legs at all. And there was so much swelling there. And I wish that I would have known more to do at that point because you could see, and so I think there's a lot of different instances that someone could benefit from it. So looking for that certified lymphedema certified lymphedema therapist, which may be a physical therapist, occupational therapist. You may have a massage therapist who has a specific lymphedema or lymphatic drainage credential. And so asking that. We'll include the link to the LANA website, because that's a really good resource. That's where I first saw your name actually was listed there. And then we can include maybe the best way to contact you, your email or something if someone did have follow-up
Absolutely.
questions. And you're located in New Orleans.
Yes.
Okay.
I
Yes.
work at the Ochsner Sports and Orthopedic Hospital in Elmwood.
Okay, sweet. So we'll include all of those resources. And is there any other thing that is important to you to share on the lymph system, lymphatic drainage, anything that you kind of find yourself saying to people just when they hear what you do that we haven't covered yet?
I think we've covered so much. I think that as far as lymphatic massage goes, it's all about expectation. If a healthy individual does a lymphatic massage and goes into it saying, I want some maybe temporary assistance with what I know is a perfectly functioning system, but maybe I want some temporary benefits and just a relaxing massage. Absolutely. I think there's a big difference between that versus someone going in saying, believe that I need this because
Right.
something is not working and that this is going to change things permanently. Those are two very
Right.
different ways of approaching a massage. I think that's important. As far as what I would love for people to know about the lymphatic system is, it's such a unique and special part of our body and often underrepresented. And one of the reasons I think it is that way is because it works so wonderfully and it benefits from just very simple and very approachable methods. Like you said, maintaining healthy hydration, movement, all of these things that we know are generally good for our health, our lymphatic system is just going to appreciate as well.
Sweet. I love all of this. Thank you so much, Shannon, for your time. It's helped
Absolutely.
me understand a lot more to visualize it and understand it. And again, lymphatic drainage, it's one of those areas that, there's the clinical reality, and then there's also with the messaging on social media or these other platforms, it may not always line up. So thanks for helping to really bring that into focus for us.
Absolutely. Thank you for having me.
Yeah, so I think this has been a really, really useful conversation. So to kind of sum things up, for those who need lymphatic drainage, medically speaking, it can be incredibly important. For the rest of us, though, there's those basics, our movement, our hydration, our overall health. All of these things are going to go such a long way. As always, we'll include the links that we talked about in our show notes. And if this is something that you've been curious about, I hope that this gives you a clearer way to think about what's worth your time and what's not. And always let me know what you think. I love to hear about it. I am registered dietitian Molly Kimball, and you've been listening to Fueled Wellness and Nutrition, the podcast. If you'd like more Fueled Wellness and Nutrition, please head over to mollykimball.com, and you can follow me, Molly Kimball RD, on Instagram, Facebook, and Twitter. And if you haven't yet, please go to Apple Podcasts and subscribe, rate, and review this podcast. Join us next time for another dose of Fueled Wellness and Nutrition. Thanks for listening, and stay focused on living your strongest, healthiest life.